one of the things that I always felt that we were missing in our practice is kind of in between. We've got both ends of the spectrum, but what about those people that they want a little bit more than the hero? They want a little bit more. They have some superficial wrinkles, or they want to get a little bit better texture, but they can't spend 5 days or 7 days of downtime. And so we now have added a new system, and this is called Moxi, and it's in the Sciton family, and we're just adding this. It's been around for maybe a year or so now, but we're excited to bring it to our aesthetic center, and I think it's going to give us that complete spectrum of lasers now that we can use for our clients. So what is Moxi? Moxi is a non-ablative laser, but it has a little bit longer wavelength, 1927 nanometers, and it can penetrate down to approximately 200 microns in the skin. So we can get down into the dermis a little bit besides the epidermis, but we're not ablating the skin, so we don't have downtime. So what are we looking for? We're looking for things that we can brighten the skin, tighten it just superficially, pores should look better, skin should feel better. And again, with these laser systems, we can customize and we can do them together. Like, for example, you can do a BBL Hero with the Moxi, same session. And so it gives us just a bigger array of things we can do. We can use this system on the face, but we can also use it on the neck, chest. We can use it on other body areas as well. So this is an example of the Moxi. And this one has a handpiece with a smart adapter as well. With the Moxi, it's a little bit more than the Hero as far as aggressiveness. So with something like this, we're going to have you come in. We're going to, again, cleanse your face, get your headband on, and we're going to put a topical numbing medicine on you for maybe 20 minutes or so. We'll take that off just to take the edge away. At that point, we cleanse all that off, and then we have eye shields on you, and then we treat the areas. And we have a couple of different levels that we can treat depending on your skin type and what your desires are. And we treat the entire face. It takes just a short period of time, maybe 15 minutes or so. While you're having the treatment, it's very comfortable because we've used a topical numbing medicine. We will be telling you what we want for skincare before and after, and you can expect a little bit of dryness and some peeling that's fairly mild. Now, these photos are from aesthetic care given to us from Sciton because we're just getting rolling on the Moxi ourselves. But here's an example of a patient that has had, I believe, just a couple of Moxi treatments, but you can just tell the difference of the pigmentary changes, especially the browns, the mottled pigment, just the improvement to that radiance. Their texture and their pore size has also improved on these. Again, good skincare is really important. And that's just a close-up of the same skin. So as you can see, skin just looks better and feels better. Now you can combine this as well with a BBL and a Moxi. We can do them on the same day and even get better results. Now this here is a schematic kind of showing you the difference of the downtime between the Moxi and the Halo. So this would be pre-treatment, and then this would be day 1 through 5. Now, as you can see, you get a little bit of red on these. The browns, you can see a little bit more. Skin gets a little bit dry. The texture might feel a little bit rougher as you're healing. But as you can see with the Moxi, you can go about your business. You can use moisturizers. You can use your products. I would tell you which ones you can use. You have to use sun protection. You can wear makeup for females. So, you know, you can go back to work. You may have a little bit of redness, and depending on how aggressive of Moxi we do, you may have a little swelling for a day or so, but you don't have to stay at home in your house. Now on the halo, it's a little bit different story. As you can see, you're going to see especially this pigment change, because you get these what we call microscopic epidermal necrotic debris, and these little areas of sun damage and pigment changes come up through the surface. So that area looks dark and real pigmenty. If we're doing a more aggressive halo for deeper wrinkles, you're going to have more swelling. You're going to have sometimes a little bit of crusting. And so that's harder to be out in public, and you can't really cover that with makeup. So you're going to have at least a few days of downtime with a halo. So there's the difference, is really the downtime, how it fits into your life. The halo is definitely more aggressive. So if you have deep wrinkles and you have the downtime, we're going to probably swing you into this area. If you have more mild or you want to not have downtime, we're going to look more in this thing. So we can customize.